Welcome back to another Research Connection. Today I'm here with Dr. Margaret Gruen and Rachel Caddiell. Dr. Gruen is our Associate Professor of Behavioral Medicine and Rachel is a CBS PhD student, and they're going to talk about a recent grant studying pain sensitivity differing between dog breeds. So do you guys want to tell us a little bit about that?
Sure. We were really fortunate to have this grant funded by the American Kennel Club and by the Canine Health Foundation. And it's a grant that's looking at pain sensitivity in different dog breeds. So it started from an idea that I had, a project I did as a postdoc at Duke, where I did a survey of veterinarians and general public members looking at how people rate pain sensitivity in dogs of different breeds. So we did 28 different breeds and showed people their pictures, and we found that both members of the general public and veterinarians were rating these dogs as having different pain sensitivities, from most sensitive imaginable to not at all sensitive. And in the general public, it was mostly driven by size, so the smaller dogs were rated as more sensitive to pain. And then on the veterinary side, there were really extreme ratings, but they were very different. So for example, German Shepherds and Siberian Huskies, who would be rated kind of middle to low on the general public side, were rated as extremely sensitive to pain, versus Black Labs and Golden Retrievers, who were rated as really low sensitivity. And so we were really interested in understanding what's kind of underneath this and what impact does it have. And so we put in the grant and got the funding to look at pain sensitivity in 10 of these different breeds.
That's awesome. Can you explain a little bit about the scope of the project and what you guys are doing on a day-to-day basis?
We selected 10 of the breeds where we would have a range of sizes and where we would really be able to look at those breeds that had a difference between the general public and veterinarians. So breeds of interest were selected, and then we brought them in, and we can't ask them how sensitive they are to pain. We can't ask them to rate their pain. So the stand-in that we have is to do quantitative sensory testing, which basically asks the dog, at what point do you say, ouch, that hurts? And so it's voluntary on their part. Rachel and Dr. Cunningham, who worked on this, made it a fun day for the dogs. We did cognitive testing as well. But one of the pieces of what we would do is have them come in, and we'd, for example, place a probe on them that was warm, and as soon as they pulled away, we'd record that so that we could look at whether there were differences in the different breeds.
That's awesome. Do you want to talk about it a little bit more, Rachel, about what you did personally on the project?
Yeah, so I got to help Dr. Gruen and Dr. Lascelles in deciding what cognitive and behavioral tests we wanted to do with the dogs in addition to the quantitative sensory testing, as we wanted to investigate if there was any behavioral reasons for these differences that the veterinarians reported in the pain sensitivity, if that related to the specific breeds or different sizes of dogs like the general public predicted. And so how the day sort of went was that I really worked alongside Dr. Cunningham on recruitment for this study, getting owners in, talk to them a little bit about the project, do some questionnaires so they could report behaviors that they noticed in their dog at home. And then we'd bring the dog in, get them comfortable with us as the researchers and the different spaces that we'd be in that day. So sometimes this involved giving them really yummy treats like our easy cheese, or playing with them for a bit. And then once they were comfortable, we performed a physical and orthopedic exam just to make sure that these dogs were normal, non-painful dogs, as that was something we were interested in. Looking at these breeds across dogs that are about in the same health condition. And then we do that quantitative sensory testing that Dr. Gruen described, letting the dogs display their behaviors, so telling us when to stop and telling us when they were comfortable. And then we'd also go to the fun room, which we dubbed the cognitive room. And this is when we'd get to play some different games with the dogs, which the owners really enjoyed hearing about as well. We'd get to see if the dog was an optimist or pessimist using the judgment bias task, get to look into the dog's attention span, and also see how the dog thinks a little bit, whether they can control their inhibitions when it comes to a different task involving food. And then at the end of the day, we do some emotional reactivity tasks, just see how the dog reacts to a novel object and a stranger. And the dog would always go home with a report card and a little toy, so everybody was a winner.
That's awesome. And so what are kind of your goals with the veterinary community with this kind of a project? Because I know it's a long-term project too. It's been 2 years, I believe. Yeah.
Yes. I mean, I really can't overstate how much work they did, bringing in over 180 dogs in about 9 months. It was really incredible. And a second part of this study is also to look at whether breed makes a difference in how we give pain scores in the ER and in the hospital. So we have records from almost 5,000 dogs where we've extracted data and are looking systematically at that. And so really for the veterinary community, we want to understand whether there are any differences really between breeds and their pain sensitivity. If there are, that could affect how we treat. I mean, it could affect personalized medicine, but also could be a really interesting avenue of research on the genetic underpinnings that might control some of this response to pain or painful stimuli. And then if there isn't a difference, then we really need to understand more about where these perceptions came from, why they're there, what is it that's driving that. So when Rachel was talking about those behavioral pieces, that might explain a piece of where this is coming from. And really understanding if there's an impact on how we practice veterinary medicine. So there's a lot that we can gain from this study and that we're just starting to be able to put out now.